Welcome back. This is Dr. Chris Nelson and
Dr. Mike Nelson.
And here we are, and today's topic for our video is the tongue test. That's something that we talk with our patients in the concept of two-way toothbrushing. And if you take a look back at one of our previous videos, we have a video on two-way toothbrushing. So, I want you to check that out. Watch that video first, and then come and watch this, and this will expand on the concept of two-way toothbrushing. So, Dr. Mike, aka Dad, what is the tongue test?
Well, the tongue test was kind of created by me when I was trying to tell people how to know if they really did a good job. Two-way toothbrushing is a great concept, and kind of the concept of that is brush longer, don't brush with toothpaste when you're cleaning your teeth. And how often do you have to clean your teeth? Most people brush twice a day, but they brush the same way each day, each time. You need to do a good job once a day.
And that's what most people, they don't think about. They think, oh, I'm doing a great job, I'm brushing my teeth 10 times a day, and they think that's the answer. But if you watch our other video, you'll see in the concept of two-way toothbrushing, we recommend cleaning your teeth one time a day.
You only are told to floss once a day.
Right.
And we all think that's good enough to clean. And so the same concept goes with toothbrushing. So we're going to start with a little exercise. Just take your tongue and run it over your front teeth at the gum line. Feels pretty clean. It's always clean. Yeah, good. Now go to the outside of your upper molars and feel right at the gum line.
Like back here?
Mm-hmm.
I mean, I just ate lunch, so it doesn't feel super smooth.
Yeah, me neither. Now check the tongue side, the inside of your bottom molars.
On the tongue side, the inside, on the bottom.
Curl your tongue over a little bit. If you can do that.
That feels cleaner down there for me.
Does it feel clean to you? Usually, people will find some slime or some film at these molars, and what that means is that this morning when you brushed your teeth or last night, you didn't brush those surfaces effectively, and it's allowed the bacteria long enough to colonize to form a film, which you've all heard is called plaque. And so the upper area we call, that's the money shot. That's our smile. Everybody brushes here really well, and it feels clean. But when you go back here, we kind of shortchange ourselves sometimes. So what you want to do in explaining the concept of the tongue test is before you start your brushing, before you start your cleaning, run your tongue around the upper, around the molars, and see what you have to target. Then apply two-way toothbrushing. Brush longer than you might normally do. Target the gum line and brush about 10 seconds for every 2 teeth if you have a Sonicare. If you have an Oral-B electric toothbrush, 5 seconds per tooth on the outside. And that'll be about 30 seconds. 30 seconds, do the inside. That's about 2 minutes on the uppers, 2 minutes on the lowers. Then you've done two-way toothbrushing. Repeat the tongue test.
So what you're saying is we want to check ourselves after we've cleaned our teeth with no toothpaste to see if we got all the rough spots that we found before we brushed our teeth, right? Is that what you're saying?
Right. And the reason we don't want toothpaste is toothpaste has soap and astringents. That's all that yummy flavor and the lip-smacking pop that it has. But that makes your tongue less able to feel the plaque. So we don't want to use toothpaste when we're doing this clean. We will use toothpaste in a second, and I'll tell you about that. If you missed a spot, go back and brush a little bit differently. Maybe don't push as hard. Maybe come at a little different angle. Go back and then, after you spend 10 seconds, 20 seconds on that area, recheck it. Compare the upper front, that's clean. Compare the spot you missed. And if it's clean, you're done. Then we don't forget to get between the teeth, whatever your tool is. floss, toothpicks, all those things. But now you can medicate. And medicate means your favorite flavor toothpaste. Maybe you're using a desensitizing toothpaste. Maybe you want to use a mouthwash, a special medicated mouthwash for breath, for remineralization, fluoride. You get to pick the product that's right for you. That's what you finish the clean with, and you're done.
Then you get the best of both worlds. You get the cleaning from the dry brushing and flossing, but then you also get the refreshment side of adding that toothpaste in to have your mouth taste good and feel good. So I hope that is of value to you. The tongue test, it's something we teach to all of our patients, and now for all of you out in the internet land, you get that information too. If you have any questions or you want to reach out, you can put them in the comments. I read all of them. I'll reply to you. If you're in the Redding area or greater Redding area, Northern California area, and you like what we're doing, come on up. Both of us love meeting new patients, and we love helping people learn how to be personally responsible for your own personal health and your oral health. We love helping people with that. So how's that sound? The tongue test.
Great idea.
Okay. We'll catch you on the next video.